Hi, my name is Dr. Emily Rule. I'm a physical therapist and owner of Wings Physiotherapy. Today, I want to just do a quick video talking to you about the anatomy of the pelvis and the pelvic floor. So, this is what your pelvis looks like. This is a female pelvis. And inside, you'll see all of our organs. So, you've got your bladder here. This is the uterus, and this is the rectum. So, the bladder is where urine is stored. And then that is going to come out when you're ready to urinate out your urethra here. Then you've got your uterus. That's where a baby is going to grow. And then the baby will come out through the vagina. And then here's your anus, which the rectum is going to hold. This is the rectum here, is going to hold poop or fecal matter. And then when you're ready to go, it will come out the anus. So you see all of this red part here, that's all muscles. That's your pelvic floor muscles. So you have the superficial ones, which are going to control and kind of squeeze off those openings. So your urethra, it's going to squeeze and hold it closed until you're ready to pee. That way pee is not just leaking out throughout the day. Same thing for your anus. We don't want poop to just come out as it's made. So that muscle around there holds nice and tight until you're ready and you tell your muscle to relax and to go to the bathroom. Now, sometimes you might have pelvic floor issues when those muscles aren't doing the right thing when they're supposed to. So maybe you're ready to go to the bathroom and they're just holding tight and you're going to have a hard time going. Or the opposite, they might be relaxed and you might be leaking when you don't want to go. Those muscles can also help to control sexual function. The deeper muscles here, the levator ani group, are going to provide support. So if you look, those muscles kind of sit on the bottom of the pelvis and they're providing support for all the abdominal contents that are on top. These are your hip bones here, and this is your spine. So that's just a brief overview of the pelvic floor. If you are trying to exercise the pelvic floor, a good way to be is to look at the bottom of the pelvic floor. So you can lay down and hold like a mirror so that this is the view you're getting. Obviously, it's going to be covered with skin, but this is what you would be looking at. And try to do what we call a Kegel or contract those muscles. When you do that, you should see this area here called the perineal body. So between the entrance of the vagina and the anus, you should see that almost draw kind of up and in. If you're doing it the wrong way, sometimes you might be pushing down and that's going to cause this area to bulge out towards the mirror. You want it to come up and in like it's drawing up towards your belly button. There'll be a whole separate video on the proper way to do Kegels, whether or not you should be doing Kegels, how many you should be doing if you are doing them. So stay tuned. If you have any comments or questions, please post them below and don't forget to subscribe.